Hi everyone, it's Jaclyn, Dr. Jaclyn. I am a general dentist with Dental Designs Singapore. As a general dentist, I really enjoy restorative dentistry. You can think of restorative dentistry as basically the science and the art of reconstructing damaged teeth, whether the damage be from decay, wear, or some other issues. And this is something that I guess most people can understand as part of a dentist's job, reconstructing teeth. So let's look at this interesting case together. So this case is interesting because it is seemingly simple on the surface. So basically it's a case of replacement of two white fillings. So white fillings are basically plastic fillings that are placed into the teeth to fill in usually like some cavities caused by decay. And this case is really interesting because this is actually on a fellow dentist. So if you ever wanted to know, do dentists get cavities? Yes, we do. I have many fillings in my mouth as well, so I understand what it feels like to get a filling done. And when a fellow professional actually comes to you because they want you to do their dental work, I would say there's no greater honor, because as fellow professionals, we know the good, the bad, and the ugly around most dental procedures. So I guess as a professional in the field, like, you will be actually quite squeamish about going to someone because like how much things can get messed up if it's not done properly. So the fact that this colleague came to me after having this area treated twice is a great honor, but also there's some pressure because this is the third time this area has been treated and the results were not satisfactory up to this point. So if we look on the surface, actually the fillings don't look too bad. So the main issue that was happening was a food trap in between the two teeth, and the patient was unable to floss properly between the teeth. So when she put the floss in, she's able to get the floss in, but when she tries to pull the floss out, the floss will get torn or it will get stuck. So in this photo, we can see, there's a pretty big filling here, and there's quite a bit of staining and discoloration. There's this pink discoloration, which I'm not sure, what is going on. But when we look at the x-ray, we can see the issue with the flossing. There's a really big overhang. So an overhang is basically this bit of, filling which is sticking out. Ideally, when we do a filling, we need to follow and respect the original shape of the tooth. So that original shape would be like that. So you can see that excess material here, which should not be there, because that will cause issues with the gums, right? And also the profile of the filling, so on the adjacent tooth, should actually be a bit broader so that the gap in between the teeth is not so wide. And when the gap is not so wide, it's less likely for food to get stuck there. There are several challenges with regards to this case, like the gum is actually really close to where the filling is. So if we just draw in the gum level, basically it's almost touching where the filling on the molar, which is the larger tooth. And so this actually creates a lot of challenges for us when it comes to doing these kinds of reconstructions. So the first step is to actually remove all the filling material. And you can see there's a really wide gap in between the teeth. So this creates a lot of challenges for us because you're trying to reconstruct the missing parts of the tooth, but you're trying to do it directly in the mouth. So you can think of it as like we are doing a sculpture, but it's not just a normal kind of marble sculpture. We are actually recreating, I should say, the functional anatomy of the tooth. But we are doing it in 3D inside the patient's mouth. So you can think of it as a sculpture, a living sculpture almost, because this reconstruction that you are doing will go off and live with the patient after that. In order to get this level of result That's the kind of effort that we have to go through. And hopefully this will give you a better understanding of some of the technical challenges that we face. So I hope that this episode of Before and Beyond was informative and interesting to you. If you have any questions about this particular procedure, you can always drop them in the comments below and we will be sure to reply to you. And I hope to see you on another episode of Before and Beyond really soon.